to my YouTube channel. If you're a nursing student who finds OBG a bit tough, don't worry, I have got you covered. I will be teaching you OBG in a simple and interesting way so that you can understand every topic easily. So today I'm going to teaching you about what is preterm baby. In OBG that this is one more question that most of the time in exam they will ask. So I have brought with answer the question. So what is preterm baby? Then what are the clinical features of preterm baby? And explain the nursing management of the preterm baby. So this will be the question which will be usually asking in the board exam. So I will be helping you to prepare according to exam the answer how to form. So first let's see the definition. We'll move according to the definition. So definition is that the preterm labor is defined as the presence of uterine contractions of sufficient frequency and intensity to effect progressive effacement and dilation of the cervix prior to the term gestation. So here in this definition they are usually saying what is the preterm labor. They have defined presence of uterine contraction before the delivery of the baby. Some uterine contraction will be there. So that contractions will sufficient frequency and intensity. Like frequency, regularly it will be starting. Sufficient time means more than so many continuous the frequency and the intensity the regularly it will be starting. To effect progressive effacement. They will be effacement means the thinning of the uterus, cervix, and the dilation of the cervix. So dilation and effacement will be progressively it will occur and in the prior to term gestation. So that the term gestation means between 20 weeks and the 37 weeks. So after 20 weeks and if 37 weeks before it starts any this uterine contraction, it will be known as preterm baby. So I hope that you understood. So I will read once more. Preterm labor is defined as the presence of what is uterine contraction. Presence of uterine contraction of sufficient frequency continuously and intensity very it will be severe. Then to effect progressive effacement and dilation of the cervix. So it will be helping to effacement and dilation of the cervix, dilation opening of the cervix and thin. Then prior to the gestation. Prior to gestation, usually term gestation will be using 38 week or 39 weeks. But here here it will be occurred before 37 weeks. So it is the meaning of preterm baby. So next, what all are the causes? Let's see the causes. So first is infection, bleeding, stretching of the uterus, maternal infection, then maternal history, uterine factors. So let's see the one. So before seeing, this is the 6 points which is the causes usually we can write in exam. So I will give you some mnemonics to remember. So you can remember MIS, miss, and then mub, miss, mub. You can remember like this. So miss for maternal factor, maternal factors, I for infection, S for stretching of the uterus, stretching of the uterus, then M for maternal history, U for uterine factors, then B stand for bleeding. So you can remember as miss, this one is miss and mub. So this will be when you can during exam you can easily remember what all are the causes of a premature baby. So it will be miss, mub. If you remember, you will get easily miss for maternal factors. Then we can see one right. So infection, first one is infection. About 40 to 50% of all preterm labor can be traced to infection. Many women do not show classic signs of infection like fevers. So many women will not show the fever and all because of infection. But most of the cases, the 40 to 50% due to the infection, the mother will be getting the labor pain start before the 37 weeks. Then bleeding, here most of the in hospital you can see most of the cases will come, like mothers will come with the complaints of bleedings. We have bleeding or leakage, PV leakage, like per vaginal leakage. Due to that, this one premature baby can occur, premature labor. After that, stretching of the uterus, the stretching or over distension of the uterus has also been linked to preterm birth and labor and birth. This can be causes for fibroids, multiple pregnancies, or even having too much amniotic fluid. If there is a high polyhydramnios, amniotic fluid will be more, the stretch uterus will be stretched. If there is fibroid any stones, the uterus will get stretched. Because of that, the mother will go for preterm labor. Then like that, maternal factors like low socio-economic status, they cannot afford for a regular checkup and all health, and maternal age will be less than 18, or that 40, more than 40 years, like elderly primigravida, and low pregnancy weight, if there is very less weight, and smoking, substance abuse, any kind of nicotine and all, if they are consuming the maternal factors, it will be including, so it will be go to preterm labor. Like that, only maternal history, like previous, if their mother had previous history of preterm delivery, already mother had gone with the preterm delivery previous history, and second trimester abortion, if any time second trimester abortion mother has gone through, so it is chances for premature labor, next birth again, when next pregnancy, it will be like there is a possibility. So uterine factors like uterine volume increase, uterine anomalies, trauma and infection, any abnormality of the uterus, infection and trauma to the uterus, this you all will be the causes. So let's see once more what all are there. So Miss MUB, M for maternal factor, I for infection, S for stretching of the uterus, M for maternal history, U stand for uterine factor, B for bleeding. So like this you can remember easy way causes. Once you can Miss MUB, you can by heart. Next you can just try to recall what was the Miss and what of the MUB full form. So inside you can write your own. Like that same we can see the sign and symptoms. So next, sign and symptoms, here are the near 5 points are there. 5 points are there in sign and symptoms. So this five points also I will give you the tip to remember, how to remember some tips, like most of the time we are taking when after PUC like PCMB. So PCMB, that time it will be physics, chemistry, maths and biology, but here you can remember PCMB. So here C square you can just remember. So PCMB. So what all the P for pelvic pressure. Sign and symptoms. This is the sign and symptoms mnemonics. So pelvic pressure. Next, first C for cramping. First one is cramping. Next is change in vaginal discharge. Change in vaginal discharge. You can remember easily if you remember just this PCMB mnemonics. Now M stand for more than 6 contraction per hours. More than contraction per hour. So in sign and symptoms only you have to remember PCMB, then these all you can remember. P for pelvic pressure, C stand for cramping, then C stand for change in vaginal discharge, more than 6 uterine contraction per hours, and B stand for backache. So this is enough to, if you remember only this much, PCMB and C will be square. So this much is enough for sign and symptoms. Inside you can write your own. So here first you should remember the mnemonics way, sign and symptoms, then only you can write in exam. So what is the PCMB? We can see one. So more than 6 contraction per hours. So it is normal for the uterus to contract or tightens as the pregnancy progresses. Contraction that happen more than about every 10 minutes, though could be a sign of premature labor. So there should be there is a normal for uterus contraction, like it is a normal, but when it is more than six contraction is normal. But when it is more than six contraction, it will be there within an hour per hour, and then it will be about every 10 minutes it will happen. So then we can say that the mother, because the physicians, they will observe the obstetric and gynecologist, they will observe, keep for observation mother, and they can do with that, they can say that it is a preterm labor. Next is change in vaginal discharge. Usually the vaginal discharge is white discharge, but it will be like red color bleeding, or it can be PV leakage, per vaginal leakage, like it can be the this one it can be amniotic fluid leakage. So we can see that by vaginal discharge also they can understand it is a preterm labor. The next is cramping. Mother will be having abdominal cramp, also like they will feel like periods cramp, how we will be having same cramps mother will feel at that time. Also backache, a low backache mother can feel. Due to that, this is also sign of preterm labor. The backache may be come and go or be steady initial a dull ache. And pelvic pressure, like woman in premature labor may feel a low down pelvic pressure, as if the baby is pressing down on the cervix. So here the mother will feel like there is there is pelvic pressure, like someone is pulling, baby is coming down, like that mother can feel also. Like low back pain, suprapubic pressure, vaginal pressure, rhythmic uterine contraction, cervical dilation and effacement, possible rupture of membranes, expulsion of the cervical mucus plug, then bloody show. So the show will be mucal plug. Show means mucal plug, that will be bloody, like red color. It could be usually white color, but it will be red color. So these all the sign and symptoms. So once more you can remember PCMB. So you can tell me now what was the P for P stand for, C square stand for, M stand for, and B stand for. Just you have to remember PCMB, so you can usually guess and write your answers for sign and symptoms. Next is warning signs. What are the warning signs for premature baby? So contraction every 10 minutes or more often, change in vaginal discharge, leaking fluid, like or bleeding from the vagina, then pelvic pressure, the feeling that your baby is pushing down. Next one is low dull backache, cramp that feel like menstrual period pain, abdominal cramps with or without diarrhea. So these all warning signs by which you can understand the mother is going for preterm labor. So like that, only factors associated with increased rates of preterm birth. What are the factors that are associated with increased rates of the preterm birth? So increasing rates of multi fetal pregnancies, like it is not a single, but it is twins or multi pregnancy should be or greater percentage of birth to women of advanced maternal age, like greater percentage of birth will be there in maternal advanced age, more than 30 or 40. Increased rates of symptomatic infection, labor induction, cesarean birth and scheduled birth. This all, if the mother has gone through this labor induction and all, it will be affect premature baby. Advance in maternal fetal management. So this is if you want, you can remember this part also. So next question is management. So what all are the management of the preterm labor? So first, manage labor. The labor is judged to have started when the woman experiences regular painful uterine contraction, then accompanied by either show, rupture of membranes, or complete effacement of the cervix. So these all are the signs of like mother is going for preterm labor. The principles of the management of preterm labor, mainly the principle is, what is the principle? So to prevent asphyxia. So asphyxia usually we have to prevent, because asphyxia, because of that only the baby can have so many complications and baby can die also. So we have to mostly prevent asphyxia or RDS, or to prevent birth trauma. So in first stage of labor, what we have to do? First stage of labor is start from the uterine contraction. So what we have to do? The woman is put to bed to prevent early rupture of membranes. First we have to put the woman in bed, then oxygen given by mask. They have to give an oxygen and ensure adequate fetal oxygenation. Also they have to check the fetal oxygenation is proper. Then strong sedatives or acceleration of labor is to be avoided. Like strong sedatives, like sedatives means any anesthesia and all strong, that they should avoid, or epidural analgesic is the choice, or they can give epidural analgesic. Then progress of labor should be monitored clinically, or electronic monitoring. In case of delay or anticipating to tedious traumatic vaginal delivery, it is better to deliver by cesarean section. So in case of if there is any risk for vaginal delivery, they can go for cesarean section. So this is all the first stage. We have to woman receive oxygen, we have to provide then acceleration, we have to avoid the sedative, and we have to give analgesic like in the epidural analgesic. Then we next is second stage of labor. I hope you all are understanding my class. Next is second stage of labor. So the birth should be gentle and slow to avoid rapid compression and decompression of fetal head. So second stage, which birth should be gentle and slow, it should be. Then liberal episiotomy should be done under local anesthesia. The episiotomy means they will give the perineal cut, so that baby's head can come easily, they can avoid the asphyxia or fetal distress. Then under local anesthesia it should be, then especially in primi gravida to minimize head compression. In primi gravida the vaginal opening, it will be very less, so it will be small, it's difficult to open, so then baby's head will be not coming out easily. Because of that, they will especially give the episiotomy. Then tendency to delay must be curtailed by low forceps. The cord must be clamped immediately at birth to prevent the development of hypovolemia and hyperbilirubinemia. So if they have to clamp the cord immediately after birth, because due to that mother will be going for hypervolemia or hyperbilirubinemia. Then to place the baby in the intensive neonatal care unit under the care of neonatologist. So they will give the intensive care, they will keep in the ICU under neonatologist, or pediatrician. Then preterm fetus is before 34th week present by breech or generally delivered by cesarean section. Now what are the immediate management? So once the baby deliver, what they have to do immediately? So cord is to be clamped. First we have to clamp the cord quickly to prevent the hypervolemia and development of hyperbilirubinemia. Hyperbilirubinemia means increased level of bilirubin in the baby. The cord length should be 10 to 12 centimeter. In case exchange transfusion will be required due to hyperbilirubinemia, they will do the exchange blood transfusion if there is a hyperbilirubinemia. Then the air passage should be cleared of mucus promptly and gently. They have to clear the airway promptly and gently, and they have to clean the mucus and all. Then the stomach content are also to be sucked out. Adequate oxygenation must be provided. The mother can be have this one amniotic fluid that baby can if mistakenly taken inside so stomach, they will clean, and oxygen they will provide. The baby should be wrapped in a sterile warm blanket or towel, or laid in the warmer with the head slightly lowered. Then vitamin K in a 1 mg injection to be intramuscularly given to prevent the hemorrhagic manifestation. Bathing is not appropriate for the preterm baby. So if bathing is there, preterm baby, it can be hypothermia go for. So preterm babies are functionally immature and need special care for this survival. So this was the topic I have covered. Thank you so much for watching. I hope you all understood this.